but the patient can feel it too, and so you can make it slightly objective. Come on, guys. Come pop it. So sometimes I make my patients feel it themselves as well, so they can feel the change. Sorry.
Just notice his shoulder.
You feel how hard that is? Yeah. Okay. And then we can check, if we want to, we can check range of motion. So left ear, left shoulder, tilting your head. Is that it?
Is that it? Yeah.
So it's got a little more that way. Which way feels harder? So, yeah, so this is getting tight and causing that to compress on that side. So tension on one side of a joint causes compression on the other, right?
So out of what is the indication that we're treating here? Sub.
This is a upper trap.
Yep. Correct.
So with Peter here, kind of, if I just direct it down here, I'm kind of going to the apex of the lung a little bit. But if I pull that up and go here, I'm not directing it into the lung. Okay.
And it's okay to be directing towards the airway, as in, the trachea. So you
Remember, this only goes
so deep.
1.5
centimeter.
Yeah,
That's
plenty.
I got a big buffer there. If I'm getting them in the trachea, there's something wrong with
Yeah.
So I can pull him up like so.
About 4.
Now I can, again, when I work on patients, I don't tend to do that. I'll just work on them and ask about if they have any symptoms in the lungs. Okay, usually it's a cough or like a tickle. Okay.
Anything in the lungs at all?
Again, I'm not pushing. I'm not compressing the spring at all. Right? So he's got a good, the upper traps and the supraspinatus here. I got to get through them.
Yeah, good. I was to make sure with the block.
And then I got to get through some ribs and intercostals before I get to the lung, right? So if this only penetrates a centimeter to a centimeter and a half, it's unlikely that I'm going to affect the lung. But I always ask.
We can always treat them in.
Sorry, what would happen?
It irritates. It can irritate the lungs.
Yeah.
Yeah.
But nothing else.
It's like your telltale sign. Yeah, you don't want to continue if that's happening.
Worst case scenario.
I think it can cause pneumothorax.
But that's something you'd have to really be ignoring the obvious sign, right? And persisting,
Yeah.
It's not like,
So
yeah.
like coughing up blood and stuff.
How's that going for you?
Would you always do them in sit-ins for these areas, like traps? If you lay them sort of prone, you can get sort of more of the bulk to come away from there, I suppose, as well.
Yeah. Again, you can.
Personal preference.
Yeah, you can change it up. I like seated because I can get
Down,
I
yeah.
can get in a good position. Yeah.
And-
And also I can retest very quickly.
Like I've seen it helped a lot of treatments just using the 15 mil in that exact spot, no problems. So just depends on how deep you want to get. Yeah.
With the 36.
It's
Yeah, so that's why I use this. Okay.
it's 2.5 depth with the standard tip and more focused, like 'cause it's smaller,
Yeah,
right?
the
That's
other
broader.
thing- The other thing, like if you're working, so say he's got a trigger point here, right, in the kind of the trap over the supraspinatus, I can get the 15 mil and go here, right? Because what am I going to hit? I'm going to hit the scap, right? That's just going to refract it. So I can't hurt his lungs, right? Because I got bone blocking it. Okay. So I don't mind if I go here, I don't mind going hard.
But in the spinatus, it's always hard to get 15 mil on the spinatus if it's over the spinatus, if it's over the fossa. There's no issues there.
Because you got the scap.
She's got a hole,
No,
some
no, no.
scapulars have holes in them. Oh, my
It's a
God.
little bit thinner.
Oh, it's not
You
like.
just
I don't know.
kind of be careful and then.
Just.
Again, they'll get lung symptoms. You know, they'll be coughing or whatever. You know. So we ran out of shots. Again, if we go back to 2000. So I can hold him at end range if I want. I don't know what I did with Roland and held him at end range until I felt it release. And then his end range increased. Yeah?
And that was kind of what you just mentioned.
That's kind of what I always do because I'm always trying to increase range of motion. Right? Alright? And see again, I'm kind of ironing through here.
Really just iron just around that trigger point, don't
Yeah.
you? Not tweaking.
No.
Yeah.
And when I'm doing it, I'm feeling. This is an extension of my hand. I can feel the tissue as I glide through it. Does this glide through nice and smooth, or does it feel like it's being inhibited? Yeah, or like there's some friction. Yeah. And I keep going back until I get rid of that friction. Just hence why I call it ironing. It's like ironing a shirt. You keep going over until the wrinkles are gone. Yeah. That, or I can bring that up again. And get in here. This is obviously your safest method. You all right?
Yeah. All I could feel was my neck was moving again.
Left ear, left shoulder. Okay, so he's got almost double the range in the neck. How's that feel?
It was great. And there's no pain when or much less pain on that left side bending.
Okay.
And none of that
How's that? out of
trigger
10?
tenderness. It's 2.
Okay, so let's mark that again so you guys can all touch there. So it's not completely gone, but you should notice a difference in how it feels. Okay, so everyone have a touch. Everyone touch Peter.
Oh, that's much.
More than you're expecting today, Peter.
Feel the difference?
Yeah, definitely. So will you get him back in about a week or 10 days? Or?
I'll be
If
back
he would-
tomorrow.
If he was my patient, I would probably get him in a few days.
A few days.
Yeah.
I was
Trigger
gonna say-
points, you can do a shorter window.
That's because in the thing you're talking about once a week.
Yeah,
But
that's for
something like that, you should do,
tendinopathies, yeah.
Twice a week for a few bursts of an acute, couldn't you? And
Yeah, what I tend to do when I treat people is I'll work different spots. So today I might have worked his upper trap. Next time I might work the vader up here.
Yeah.
Okay. So I can do that because I'm working totally different areas, right? So when we say do it once a week, that's assuming you're doing the exact same spot. Yeah. Okay. But you can do other spots.
Mhm.
Yeah. But sometimes he might have 10 spots I need to treat. Yeah. And I might not be able to get through all those spots in one session.
Yeah.
So I might have to see him on Monday and then again on Wednesday or Thursday. Yeah. All right, let's do something